these are trying times that we are living in with the pandemic COVID 2019. Healthcare is a very satisfying profession, but at the same time can be very stressful, particularly around oncology. This has evidence from around the world. Um, Increased demand on planning, uh, along with the routine roles, can put staff under stress currently. Also, once COVID hits the country or there is an epidemic, there might be more fatalities, and that could be a source of additional stress. And managing and rationing limited resources could be a source of stress. Now, as a psychiatrist, I think there are some pointers towards what one could do. Is that you could self-monitor stress and ask your colleagues that or your family members about how they feel that the person is reacting. Mostly, the people around you would know that you are more stressed, even if you have not felt it. You could take time outs because it's okay to take breaks even if you are in a sort of battlefield. Soldiers also take breaks, so it's important that healthcare workers who are at war with the epidemic take breaks. Peer consultations, sitting, not many people but two or three people, talking, maintaining the social distance but talking about their stresses, can help. And also one should avoid overgeneralization because that can sometimes lead to stress and catastrophic thinking. Accepting the situation that what we are in, and having a focus that we focus on things which we could make a difference rather than what we could not make a difference or what we cannot make a difference. Avoiding working very long hours is something which needs to looked at. Healthcare workers are notorious in not being kind to themselves. So I think that we need to be kind to ourselves and the patient. There is, compassion has to be from inwards towards everybody around you. And engaging in self talk sometimes, that I'm fine. I need to be kind to myself. I need to relax sometimes. That might help some staff. Psychological first aid, professional help, or help from mentors who have more seniority in the field. Most of the healthcare staff, even if they're senior, have not faced a pandemic, but they have faced crisis. So they should take a mentoring role for more junior staff. Frontline stress control is something which teams around the world have tried to develop, and having good work rest schedules is something which the central team has to look into in any hospital. So there needs to be a command center who gives out guidelines about how things work. Many hospitals are developing sort of team A and team B, where team A working frontline inside the hospital while team B is working remotely, and then there is a swap. So that, in a way, gives some amount of physical rest to the person who is off site and also some psychological relief. But this swapping also reduces the sort of the because infection sources of infection could be random. So it we hope that would also reduce the chances of transmission of infection from one person to another. So these are trying times, as I had said, and if we plan as health professionals who deliver the care and as health managers who organize the response to the pandemic and look after not only the physical health but the psychological health of healthcare workers, because it's a precious workforce now, always, but particularly now. And if people go off sick because of stress, it would make the situation worse. So we hope that all countries are able to look into the psychological health of patient as well as staff, the healthcare workers who are delivering the care.